So friends, today we are going to discuss about the topic functions of a plate. Okay, so there are about five different functions of a plate. The first one is compression plate, and second one is protection plate, third one is buttress plate, fourth one is tension band plate, and fifth one is bridging plate. So in our previous videos we have already seen DCP, that is dynamic compression plate, and limited contact dynamic compression plate, which is LCDCP, and we have also see, seen about locking plate. Now we can use these three plates in different ways to attain our function, to get our function. So first one, so friends, we can use a plate as a compression plate in two ways. By using first one is by using a dynamic compression plate over a fracture site. So by using centric and eccentric screws, we can give compression at the fracture site. So we can use a dynamic compression plate as a compression plate. And in second way, when we fix one plate over a fracture bone, and when we try to fix with the screws, then there can be opening at the fracture site. Just to decrease that opening at the fracture site, we can bend the plate, and thereafter we can fix the screws. This also acts like a compression. So suppose I am fixing two centric screws on the B side, and to give a compression I am putting one eccentric screw on the contoured plate. Then this gives compression. So we are using this DCP or the contoured plate, that is like DCP by bending the plate, that gives a compression. So what is the main function? So we are using DCP as a compression plate. So we can use DCP plate as a compression plate. So that is the function. So friends, now we are going to know about protection plate. So what is a protection plate? Suppose we have a fractured bone that is divided into part A and part B. Now what I am going to do, just we are going to fix a lag screw which is perpendicular to the fracture site. So this helps in holding the fracture, and but the thing is, this lag screw is not cannot give you the full strength for holding the fracture. Suppose if there are any rotational forces, this cannot withhold the fracture site just with a one lag screw. So just to protect this lag screw, we are going to fix a plate which we call it as protection plate. So this is going to protect the lag screw. So we are going to fix a plate. We are going to fix a plate for more stabilization. And however, sometimes we can pass this lag screw through the plate, and sometimes we can just fix one lag screw and then put a plate for more stabilization. Such plate we call it as protection plate or neutralization plate. I hope that should be useful. So friends, now we are going to see what is a buttress plate. So the buttress plate, how it helps is, it helps in resisting the axial shear load by applying opposing force. So suppose now this is our distal femur and we have a fracture here, and we have fixed a plate by using three screws on the proximal aspect. Now in the distal aspect, at least if we can uh, cover this apex of this fracture site, this helps as a opposing force to this axial shear load, and it helps in healing, or it helps in callus formation with this buttress plate. So where all we can use this buttress plate, this is especially useful in metaphyseal injuries, that is in the tibial plateau fractures or the condylar fractures of the proximal tibia, or it can also be used in the distal radius fractures, especially in the volar bottom fractures, and it is also useful in the distal femur fractures which is involving the condylar region. I hope that should be useful. So friends, before going to tension plate, we will discuss about the anti-glide plate. So what is the difference between anti-glide plate and buttress plate? It is almost similar, but buttress plate is usually used in metaphyseal fractures and anti-glide plate is usually used in diaphyseal fractures. So now we are going to discuss about the tension plate. So friends, now we are going to see what is a tension plate. So before going into the tension plate, we will just see our femur bone. So this femur bone is not a very straight bone and it is little curved bone, and it has two forces acting on this femur bone. One is the compression force that is on the concave side, and there are tensile forces on the convex side. So whenever there is a fracture in the shaft of the femur, now, whenever we are going to fix any plate on any curved bone, we have to keep in mind three things. That is, whenever we are going to use tension plate, first of all, the bone should be a curved bone, and the plate should be fixed on the, that is on the convex side. And third one is the opposite cortex. So this cortex should be intact and it should not be a comminuted fracture. So with that, the tension plate can give you a proper fixation. So friends, now we are going to discuss about the topic bridging plate. So when is this bridging plate is used? Whenever there is some comminuted fracture and we want to restore the length of that particular bone, then we are going to use this locking compression plate. And how to fix these screws? Can we fix near to the fracture site, or is it very far away from the fracture site? So whenever we are going to fix it far away from the fracture site, the stability of the plate is more better. So the stress dissipation is better and it gives more stability. And whenever we fix the screws very near to the fracture site, the stress concentration is more and the stability of the plate goes down. So now we should also discuss the relative stability and absolute stability. So by using this bridge plate, it is going to give us relative stability. So indirectly, it is also giving us more callus. Okay, so what is absolute stability? The healing or the union of the bone is present without any callus formation. That is seen with the other four types of plates. That is, first one compression plate, and second one is protection plate, and third one is buttress plate, and fourth one is tension plate. So now we are going to see only relative stability by using this bridging plate. So whenever we are using this locking compression plate, how much length it should be there? So whenever we are using a LCP plate in comminuted fracture, we are going to use 2 to 3 times the length of the fracture site. So suppose if the fracture site, this is a comminuted fracture and its length is around suppose 3 centimeters. Now we are going to use the length of the, like with the number of the hole. So if it is three hole, then we are going to use it some 9 hole around that. And if it is only a transverse fracture, then how much the length of the LCP plate should be? It should be around 8 to 10 times. I hope that should be useful.